PPR in the sheep and goats and its control strategies. PPR is acute or peracute and febrile, often fatal disease of ruminants, and it is caused by the Morbilli virus of the paramixed body. As per OI, in India, there is cases of 250 to 1000 in the 2015 to 2019. Previously, PPR virus was assumed as a variant of rinderpest virus, but they established that two viruses are different. PPR virus causes disease in mostly sheep and goat, as well as in camels, wild ungulates, and white-tailed deer. Cattle are only subclinically infected from the PPR virus, and they are characterized by the severe morbidity and mortality rates. We could reduce the mortality rate of the PPR by avoiding the secondary complications like bacterial or other diseases. It is a high economic impact in the areas of Africa, Middle East, and Asia, where small ruminants are the livelihoods of the small farmers or landless farmers. PPR is a OI listed disease and must be reported to the OI according to the Terrestrial Animal Health Code. OI and FOI developed the PPR Global Control and Eradication Strategy of PPR, and they have targeted to eradicate this disease from the globe by 2030, similarly to as they have done in the case of rinderpest of cattle. And efficient PPR vaccines are available, and they can induce lifelong protective immunity in the vaccinated animal. The infection was first described in West Africa, and now the disease is spread in the sub-Saharan Africa, Middle East, and Asian subcontinent, including Nepal, Bangladesh, and Tibet. PPR virus is grouped into 4 distinct lineages based on the sequence of the F protein. There is only one serotype of virus, and lineage 1 and 2 occurs in the West Africa, while lineage 3 occurs in the East Africa and Middle East and Southern India. And lineage 4 extend from the Middle East to Tibet, including North India part. So in India, there is presence of lineage 3 in the southern part and lineage 4 in the northern part. Some scientists believe that there is correlation between virulence and lineage. For example, lineage 1 strain in the West Africa is more virulent than the lineage 2 strain from the same area, that is West Africa, and lineage 1 causes more virulent disease in the animals than the lineage 2. And there are 2 cellular receptors for the virus in the cells, in the host cells, that is signaling lymphocyte activation molecules SLAP and nectin-4. And these 2 receptors are known for the PPR virus. PPR is a disease mainly affecting the immunological and lymphatic system, along with some hematological changes. And the main route of infection is respiratory. That is, the disease is transmitted by the airborne droplets. Infected animals' secretions and excretions are also contagious. The virus mainly targets the lymphatic tissue, and lymphocytes are destroyed in the germinal centers in the lymph node, pear patches, tonsils, splenic corpuscles, and cecal lymphoid tissue. PPR disease causes immunosuppression, that is lymphoid destruction. Lymphocytes are partially replaced by plasma cells, macrophages, and eosinophilic acellular matrix, and occasionally neutrophils. PPR virus is epitheliotropic, means they are loving the epithelial cells. of the mouth, digestive tract. That's why they are causing the diarrhea. Digestive tract is highly vulnerable to the virus. With the loss of the mucosa of the alimentary tract, there is severe diarrhea, and incubation period is usually 2 to 6 days, and with up to 10 days possible. The clinical disease produced by PPR virus in sheep and goats closely resemble that of rinderpest, but in case of PPR, the course of disease is much smaller than the rinderpest. That is within the 1 week. While in the rinderpest, there is the course of disease is more than 1 week. With the acute form, sheep and goats typically display an abrupt rise in temperature to 104 to 106 degree Fahrenheit. Within a few days, infected animals develop nasal and lacrimal discharge, depression, thirst, anorexia, and leukopenia. Congestion of the conjunctival mucous membrane is also one of the important clinical signs of this disease. The animals infected from PPR shows oral erosions with necrotic foci, which results in excessive salivation, and diarrhea may be profuse, but diarrhea is rarely hemorrhagic, means blood rarely comes from the feces in PPR, and they tends to develop in 2 to 3 days, and it is accompanied by abdominal pain, tachypnea means increased heart rate, emaciation, severe dehydration, bronchopneumonia, particularly that caused by the Pasteurella species, may be terminal sequel of the disease. Death occurs within 5 to 10 days after the onset of fever. If proper treatment is not done to avoid the secondary complications, mostly death occurs due to is animal is not able to feed and not able to swallow, and then there is a diarrhea and there is severe dehydration. So we can prevent death by of the animals by giving the DNS to the animals, or giving the tender leaves and other diets, soft diets. In the last gestation, the pregnant sheep and goats abort with the PPR. Diagnosis of PPR could be done on the basis of clinical and pathological findings. Diagnosis can be confirmed by the isolation of the virus from blood or tissues, including lymph node, tonsils, and a spleen is a very good source of virus. Spleen is the mesenteric lymph node. Immunocapture ELISA or PCR is also used for detection of the disease. Necropsy findings. If in a herd of 50 animals, if there is death in of 2-3 animals, then we should conduct the PM of the recently died animals, and we could find the necrotic stomatitis, lower lip and adjacent gums, cheeks near the commissus, and ventral surface of the free portion of the tongue. Abomasal erosions are often present. Small intestine tear patches are markedly affected, particularly in the first portion of the duodenum. In the first portion of duodenum and terminal ileum, in the large intestine, which is the pathognomic lesion of the PPR, is the zebra stripes in the large intestine. This is the electron microscope photograph of tear patches. These are the villi, duodenal villi, and this is the tear patches. Treatment. In viral diseases, though there is no specific treatment, but mortality rates could be reduced by the treatment. If suppose in a flock of 100 sheep and goat are there, and if there is PPR outbreak, then 3-4 animals may die within 1 or 2 days. But you can reduce the death in the other animals by controlling the bacterial complications. Should apply the paste in the mouth lesions by boroglycerin, 5% of the boroglycerin, and lesions around eyes, nostrils, and mouth should be cleaned twice daily with a sterile cotton swab and boroglycerin. Long-acting drugs like oxytetracycline and chlortetracycline are recommended to prevent the secondary pulmonary infection or enrofloxacin or cetophor. Must use the anti-inflammatory agents along with the nutritional support. We should inspect the first unaffected goats and then should treat the affected goats because after means treating the affected goat, we should not go the in the herd of unaffected goats. And as soon as we got the information regarding there is a spread of infection in the goats or sheep, must isolate immediately the affected animals from the unaffected animals. That is the most important preventive measures for controlling the spread of infection. Nutritious, soft, moist, and palatable diet should be given to the affected goats. Provide the intravenous energy infusions in the anorectic goat or sheep along with appetizers. Immediately should notify the disease to the nearest government hospital. Carcasses of the affected goat should be burned or buried under field condition. In our lab condition, we incinerate all the carcasses affected with this disease, whether control or vaccinated or unvaccinated. Proper disposal of the contact fomites and decontamination is very important to prevent the spread of the disease. Vaccination is the most effective way to control the disease. All the diseased animals should be slaughtered and disposed in the large farms, but slaughtering of chicks, sheep, and goat is difficult where herd size is very low. The premises should be decontaminated and the area should be quarantined. Sheep and goat should be could be protected against PPR virus by immunization or by administration of the hyperimmune serum. As per OIE, we have the quality vaccines manufactured as per OIE standards and uninterrupted cold chain. Till now, the thermotolerant vaccine is not available. Realistic estimation of the required vaccine quantity and suitable vial size. That is also very important point from the field of view. Before delivering the vaccine, we should estimate herd size or animal number of animals that is to be vaccinated because PPR vaccine is the freeze dried vaccine, and after adding diluent in it, that is stable only up to 2 or 3 hours. So we should plan accordingly. After adding diluent in the vaccine, we should not keep more than 2 or 3 hours. Objectives is there should be 100% vaccination in the small ruminants, which is 3 months old. Practically, it is not possible in the field condition because some animals may be diseased. So, giving the vaccine shot in the diseased animal is not permissible, and some animals are pregnant, and so owner could not go for the vaccination. So he may go for 70 or 80% vaccination in a short so that there should be immunity development at the flock level or at the geographical or farming level. And vaccination program should be implemented for a minimum of 2 successive years because if in one vaccination drive those animals which are not vaccinated should be vaccinated in the consecutive year or next year, and followed by revaccination if necessary. PPR could be controlled easily by the focused vaccination in high-risk population of sheep and goats, followed by mass vaccination camp. Mass vaccination camp must achieve high levels of herd immunity, that is 70 to 80% to block the epidemic cycle of the virus. If we go for the vaccination in the large herd, then we should use the vaccinator gun. In the mass vaccination camp, it will be better to use the vaccinator gun. And there should be coordinated efforts of all stakeholders combined with proper funding and execution of control programs. We are dreaming to achieve India must be free from PPR by 26 or 27. If we use the combined vaccines like PPR vaccine is combined with the sheep pox or goat pox, then it will be better. Control measures for is very important. It could be implemented through the effective prophylactic measures. The sheep and goats of the affected flock should be quarantined for at least 21 days to 28 days after the last clinical case. Means we must give the washing period of 21 to 28 days for PPR virus. Within this time, they get touch in the other healthy flock, then they will definitely spread the virus. So we must avoid and we keep in the quarantine for 1 month of the affected flock. Animal movements have to be strictly controlled in the area of infection. Unfortunately, such sanitary and control measures are difficult to maintain in vast country like India. Animals movement control is very big challenge. Only solution we have left mass vaccination and quarantine measures. Strict quarantine and control of animal movements. Quarantine of newly purchased or newly arriving sheep and goat for at least 2 to 3 weeks. And as much as possible, the newly purchased animals should be quarantined strictly. Effective cleaning and disinfection of the contaminated areas of all premises. Normally, virus dies with alkalis like sodium hydroxide or like lime and others. Must burn the dead animals, isolate the sick animals, monitor the wild and captive animals, especially the animals which are coming in the contact of sheep and goats. Precautions for vaccination. That is very important point and often neglected by the vaccinators and the owners of the animals. We must remember the IDTST. I means intimation. We must intimate the owner that we will vaccinate the animals. D means deworming. We must deworm our animals 10 to 15 days prior the vaccination and time before seasons of outbreak. We should vaccinate only in the healthy goats and sheep. PPR vaccine is the live attenuated vaccine, and so if an unhealthy animal is there, then there may be chances to further spread the disease by the vaccination. We should prefer the vaccination in the morning time. Keep the temperature of the vaccine at 4 degrees centigrade. Do not vaccinate the pregnant animals. All information regarding vaccination should be noted in a separate diary, noting the name of vaccine, batch number, validity, and time for next vaccination. After vaccination, we do not left the animals for grazing. Should kept in the shaded area. If veterinarians follow these simple steps, then the efficiency of vaccine increases and chances of vaccine failure will be much lower. So animal movement control is very important for the effective control of the PPR. There must be an interaction between different stakeholders at a 6 monthly interval. Information platform framework must be developed for the disease effective PPR control and eradication. Approaches is very important. First, we have to increase the awareness of farmers about the benefit of the vaccination. We have to convince the farmer that if you go for the vaccination, you will be in a beneficial situation. There should be increased communication among the vaccine chain stakeholders, along with vaccination coverage and zero monitoring. With the group interviews will be used to measure the impact of intervention through key information interviews. In the KIA should be high level stakeholders about the vaccination progress. They should have the knowledge of the vaccination progress. Parts in KIA key informant interviews, the participants will be officially contacted either by emails or by phone calls to be interviewed at their workplaces. Variety of stakeholders, including researchers, policymakers, public and private veterinary services, and livestock vaccine manufacturers, must be interviewed. A list of organizations will be chalked out and NGOs identified for partnering with the PPR control program. India has a very huge infrastructure for the disease diagnostic of the animals. We have one CDDL, five regional disease laboratory diagnosis laboratory RDDLs, and 250 numbers of state disease investigation laboratories. And beside in this PPR eradication program, Nivedi, Bangalore, and 31 collaborative centers of All India Coordinated Research Project on RP and ADMAS located at different states is also carrying out disease surveillance, monitoring, and analysis of livestock disease in India. Sero monitoring going on at 31 ELISA labs established during NPRE program. There is LIMS for PPV laboratory data, ICR, IVRI, division of virology. Mukteshwar is the national apex laboratory for confirming the PPR diagnosis. Surveillance system is also going on. The sampling plan is as per OIE guidelines. ICR Nivedi is the national laboratory for the serial monitoring of PPR. Disease prevention and control measures are also important. Government of India is planning only that animal will be covered under the government schemes which have the proper tags. Untagged animals will be not covered under any government schemes. So animal identification is very important point of view. So movement control, quarantine, and stamping out. The legal framework should be in place for PPR prevention and control. Similar to prevention and control of infectious and contagious disease in Animal Act 2009 to prevent the spread of economically important infectious and contagious disease from one part of the country to another part. Aim is to promote import and export of animals and animal products by meeting the country's international obligations. Future prospects. Till date, there is no device strategy in India, but Pulbright Lab UK has developed some device strategy for PPR. They have also developed some thermostable vaccines of PPR. Till date, both technologies are not available in India. We have little information on the effect of agroclimatic zones on the PPR in small ruminants. Epidemiology of PPR is likely to change due to vaccination as the disease occur most severely in the NAPE population only, means unvaccinated population. We need more research on the host virus interaction, and we have little knowledge of the development of cellular immune response in case of PPR vaccination. So we have to develop a focus on that aspect also. We have to conduct the analytical study about the incidence of diseases. We are committed to prevent the loss of 805 crores per year due to PPR of sheep and goat in India, means 8,058.8 million by proper treating the animals, proper vaccinating the animals. We can prevent that much loss to the government and public. And worldwide, PPR causes an estimated loss of 1.45 billion to 2.1 billion each year. By 26 or 27, we have to come in the OIE status of free from PPR. We will be shown by green color. So our aim and is that India should be green colored and should be given a PPR free status from the OI.